All right, good morning. I would like to welcome everyone to today's training. As you know, we are beginning our behavioral health program, and we have on the call today Ms. Kenyatta Kaiser. She is the executive director with Here's My Turning Point Agency. She has a wealth of experience in working with behavioral health programs, getting them set up, best practices in implementing the programming. And so where we are in the process now is we've gotten the staff signed up or going through the process of enrolling, Ms. Kenyatta, and now we're our goal is to have this intake packet for 10 of our residents completed by Wednesday.
Okay.
That's the goal. So let me
I have a quick question. And this kind of goes into something I kind of heard Miss Murray saying too. So like we said, we want 10 kids. What is our age range? Can we reach out to the daycares as well for some of them that might want to be involved? And I was thinking about Anthony and
now we're
you
gonna
know,
just right now, yes, we could, but right now our focus right now is kids in the group home. That's where we want to get the 10 from right away.
okay,
We have
good to
access to
know.
their information. All right.
Okay.
Okay, I'm gonna go ahead and share my screen, Ms. Kenyatta, and
Trying to
then
make sure that sorry, I was just making sure that I had it pulled up. So, hello everybody. Good morning.
good morning.
Good morning.
So, this first sheet of this intake packet is just a checklist, making sure that everything was discussed. So, there is on here it says intake referral screening form, client handbook, acknowledgement form. So there's a handbook that we give all the clients. We know we're not reading through that. It's going to take entirely too much time. But they can have the handbook so they can all this stuff that we go over, they keep that for their record. Then they initial that because on here it's going to say acknowledgement form. That's where they sign and say that they received it. And the intake person is going to be whoever's doing helping them do the application. You see over here where it says verified by intake staff. You'll sign everywhere where it's been completed. Now, some stuff is optional. They don't have to complete the voter registration form. They may already be registered voters. We go over the client resource assessment tools, but we don't have, that's not a requirement for this intake piece. The 42 CRF is only for substance use disorder. We're providing mental health services. So we're not even going to look at that piece. The transportation statement is basically them consenting. And with everybody's application, we have to collect a photo ID and insurance card. And because we're working with kids, we need an ID of the parent or whoever is consenting for their treatment. Some of the kids participants will be 16 and older. They may have their own photo ID and insurance card, but we have to sign that we received that, and a copy needs to be sent over with their packet. You guys
You
go
said those
ahead.
requirements are the photo ID.
And their insurance card.
And then you need the photo ID is not of the kid in our sense and not of the minor. The
It
photo
should be a
ID is of the guardian.
consenting adult, because of the and the reason we make sure we do that is because there's been situations where people have a program, they will go and do like recruit kids for a program. They may pay the parents like, hey, give me your kids information, I'll get them registered and signed up, and they'll put them in the system and bill for them without actually providing a service. And then we'll come along and we have a program that they're actually participating in, and mom will consent to treatment on the paperwork. But then later, if they get like an audit or anything, say we're both billing for the same kids, the state of Ohio will step in and ask, were these kids getting services performed here? And we keep documents. So we have sign-in sheets, we have the parent's ID and insurance information, and that's for our verification to make sure that we have all these things in place so that we can be able to prove not saying that we want to have to do that, but we can prove that they're in our program versus somebody just having their information billing for them. Does that make sense?
Yes.
Let's see. So you guys don't have to worry about the intake assessment piece. This staff that's gonna sign off on this stuff is the LSW who's gonna be doing the assessment. Or it could be a LSW, a LPC, a LPCC, a LISW, a LMFT, or LMFT with supervision. But one of those clinicians will actually be doing the assessment, so you guys don't have to worry about that. But just so you
Page
know,
here, so page 3, under the intake referral screening part, we don't have to worry about filling that part out?
hold on, I'm still just going over like the items on
Check,
page
I'm
1.
sorry. My-
Yeah, I'm sorry, because I'm looking at 2 computers. I didn't even see you scroll down that far. So we'll go over the individual items. Now, discharge termination forms. When we get to that, that's when we're going through the discharge process, and it's usually the LSW who does the official discharge. And if we give them any client resource tools or anything like that in our assessment, then the staff who does that would initial there, but that wouldn't actually be the behavioral health specialist. It's more than likely going to be a LSW. And this is whenever we audit documents on this page where it says print, sign, and date, whoever is doing the audit, more than likely me, making sure everything is there. Now, the intake referral screening form, this is the most important form to be filled out in this whole thing because this is where we're going to pull their information from. So they can't skip certain things. So the staff would be whoever's doing this intake, they would put their name. If it's over the phone, they would put time of the call and the date. And then you could select whether it's, y'all don't have to worry about the client ID. We fill that in after we add them into the system. And you can check urgency. It might just be routine or urgent. Now, if it's emergency services because they're in crisis, then you want to make sure you send that over, but you do want to select that. We do services for adults and children. So that's why you see adults and child/adolescent. So you would just select which one. Now, under the client information, you will put their name, first and last name, at minimum, but you want to put first name, middle initial, last name, date of birth, and social security numbers are very important because sometimes when you get their insurance information, their Ohio Medicaid number may not be correct. It could be wrong. So you want to have a valid current address for them.
Question with reference to the address. Okay.
Okay.
So with the kids that are in the group home, the kids have the address that they're
Of the group home.
residing.
Yes.
Would it be the address of the caseworker, which would be Children's Services?
No, you will put the address where they're residing. So you would put their group home address there. And when we look up their insurance, the address that's going to be listed is going to be the address where they live, not the case manager's address.
So the address that we put here has to match the address that's on the insurance card?
That's gonna be on there. It ain't gonna be an address on their insurance card more than likely.
Okay.
It's gonna be when we do insurance verification, they give you all the information. And that includes the address. So the address has to match. So when we submit the billing, we have to use the address that they have listed with the insurance company, or that'll make the claims kick back. So you do wanna did that make sense? So if any of our information don't match what their insurance company has, it's gonna make it reject. But you kind of get it going ahead. So yeah, you will select their gender, and race, age. Then you put their insurance type here where it says insurance type. we're working with a Medicaid population, but a lot of them have what's called managed healthcare plans. You want to put which managed healthcare plan that is. So if it's CareSource, Molina, United Healthcare, Anthem, Aetna.
Got it.
Okay, then you will put the name, the Medicaid number. I don't know why it says Medicaid name group number. So you will put the Medicaid ID number on the next line. There should not necessarily be a group number on there. So that Medicaid number is usually, I think it's here. Look, I'm used to typing it so much. I don't know how many digits it is, but I can tell you. I'm sorry, bear with me one quick moment, please. I want to give y'all, make sure I'm giving y'all the most accurate information. When we get what happens is when you guys send over the packets, we verify coverage, make sure the information is accurate and the packet is fully completed. And then we verify their coverage and we send it over to the LSW to start the assessment, to schedule an assessment so they can start the assessment process.
And so this second section here where it talks about minors and client minors, that's where we put the caseworker's name and information on there. Is that correct?
Yeah, is the caseworker gonna do the assessment with them, or are they gonna do the assessment at the group home?
We do it at the group home.
Yeah, so you will want to put who they would contact at the group home because that's who's gonna be a part of the assessment process.
Okay.
And what also is, since they're kids at the group homes, because sometimes that's a little bit trickier dealing with them, they probably already have a diagnostic assessment. If you guys have one and it's been done within the last year, it's not older than a year, you want to send that over. So what'll happen, the LSW, when they get that and the intake packet, they'll review the original diagnostic assessment and they'll do a reassess with the client, just making sure that nothing changed, if there's any additional diagnosis or anything like that. So on that intake referral screening form, which is the main form, we're gonna go over their name, date of birth, social security number, make sure we have an address filled in, a telephone number, their gender and race and their language, because some people don't speak good English. So if we need an interpreter, we need to know that. We would fill in their insurance type and make sure that we put their actual Medicaid number. And then if the insurance is this part insurance verified from biller, you guys don't have to do that. This is for our use only. We have to verify coverage, make sure it's valid. If it's not valid, we will circle it as self-pay. Now, I do know that they're not paying for these services, and you are going to have some people that may not necessarily have Medicaid. So we would just send an email back to you guys letting you know that they don't have valid or active coverage. If you want, you could do like the presumptive charity to try to get them coverage, but in the interim, they will probably just be a charity client.
Right.
Okay. And then it says minor clients only. So this piece right here will be the information for whoever is the person that you're going to be contacting. So the kids in the group home, you want to put whoever's over the group home right here, or whoever the administrator is at the group home under name, address, phone number. And then under emergency contacts, you want to put the case managers and stuff like that for people to contact. And then the reason for the referral could be anger issues, any behaviors you're experiencing or seeing, or you may already know they have a diagnosis. You could put that there, but you don't got to go into great detail. It don't got to be a paragraph. Under the services referred to, it says to check below. You're going to check because we're working with kids, child, and adolescent services. I always select individual counseling, mental health day treatment services, TBS.
Say it one more time. Okay, start me all over.
Okay, under services referred to, it says check below.
Yes.
I would always, because we're dealing with children, I would select children and adolescent services, individual counseling, mental health day treatment, TBS/CPST services. You want them to have a diagnostic assessment. You want to select CPST. I don't know why they had that on here twice, but that's fine. And that's it, because our kids they're not doing, our group therapy is the day treatment piece. Does that make sense? So they
Yes.
are doing groups, but not group therapy that's listed here. And if you wanted to select like family counseling and or something like that, maybe later on down the line when we do a reassessment, we can add that in there. And it depends on how you do the referral. It could be crisis. So sometimes you would select that crisis intervention service. So for example, like I was telling you about, we have a program called Mobile Rescue Stabilization Services. So they're in crisis, and if MRSS provider it's a call and has to go out, they would be doing crisis intervention services. So they would fill this out based off the fact that the client is in crisis. So you don't have to worry about the diagnostic scheduled and who did it. That's on our end. So you would skip that. And this is just a consent for treatment. It basically, I kind of summarize this and go over it with people. It's just this consent for treatment. You're just signing that you're authorizing them to get services and participate in programming with Here's My Turning Point. And then it just breaks down. I give my consent for the staff at Here's My Turning Point, included but not limited to the psychiatrists, nurses, clinicians, interns, or staff, to share information with the agency about my treatment. If Here's My Turning Point, LLC privacy practice should be changed, I or we will be notified of the change. Just basically just summarizing it. You don't have to go into detail reading it out to them like a Bible. So once they agree to that, because they're going to get copies of this paperwork and they can take it home with them. So they're going to print their name, date it, then because they're for the minors, a legal guardian would sign and date here.
Signature or just sign?
I'm sorry.
Signature, okay, where it says parent legal, is that a signature? Or
Yes.
it's a signature, not a, because we're gonna send this to them electronically. Once we fill out most of it out, we're gonna send this to them electronically for them to
And
fill out the rest.
and you could just put mark X's where you want them to sign.
Okay, got it. Okay,
And then it just tells them about their right to refusal of service. So if they decide that they don't want to do services, they will obviously fill out the bottom part instead of the top. But then it will be no point in continuing with the application process because you're just writing at that point.
so this page number 6 is not necessary. For all intents and purposes, we don't want them signing page 6.
Yeah, but we want to have, when we turn it in, we want to turn it in a complete packet.
Okay, gotcha.
But yeah, they have a right to withdraw consent too, because it breaks it down. Like you have the right to withdraw consent for treatment. If you choose to withdraw consent, Here's My Turning Point LLC staff will explain any implications or potential consequences of withdrawing treatment. If you choose to withdraw consent for treatment, please sign below. So you would just explain to them that that's what that's for. And then this is informed consent. So client name, and then electronic transmission of information, just understanding, basically that they understand, they're a citizen, and on their behalf, you agree to participate in, basically the telehealth piece. They'll be doing like electronic, like, so it'll be like a video conference or via phone to do the assessment. And then some of the services, maybe if they need to do individual counseling and one of our LSWs need to do it, it may be a telehealth appointment. And then they talk about what it means about mobile practices and devices, and basically your privacy, about how the clinicians are gonna not share your information, any equipment, identification, telebehavioral health process, what that looks like. Additional services, just basically, I understand that it's my duty to inform the practitioner of electronic interactions regarding my care that I may have with other healthcare providers. So these are all things that they are just basically checking the boxes.
You want these to be checked?
Yeah, yeah.
Okay.
Just so we know they understand it.
Right.
And then release of information, just I authorize the release of any information pertaining to me determined by my practitioner, my other healthcare practitioners, or my insurance carriers to be relevant to therapy or processing insurance claims, included but not limited to my name, social name, date of birth, diagnosis, treatment plan, and other clinical or medical record information. So, and then breaking down the, what discontinuing care looks like. So it's really just a review going over this information. But I'll be honest, like when you go to the doctor's office, you go over all this stuff. They just hand you the packet and they tell you to fill it out. And this is just pretty much the same information that's in there.
So are you saying that everywhere we have a bullet point here, you want you want those to be checkbox, or were they just initial?
Yeah. And
Okay.
and then name, date, and witness. Now, if you're consenting for a minor, it says the above release is given on behalf of the client's name goes here because the patient is a minor or has been determined to be incompetent to give medical consent for the following reason. And then they would put their name here, date, time. And then cost sharing agreement. We kind of go over this with them, but they don't have a cost share. It says all clients are expected to pay their fees and copays at the time of services. We're not dealing with clients that have copayments. So it's kind of don't apply to them. But you just want to kind of tell them they do have to, because we have to follow the rules. So Ohio Medicaid says that we have to go over this basically if they're financially responsible for paying the claims, that this would be their responsibility, and this is what cost sharing looks like. But we're not going to be doing that. Then on this page that's under it, it tells a breakdown of like the cost of services. And that's not accurate, but this is every organization has to have rates that they send to the state of Ohio to say if they're private pay, self-pay, and they had to pay, this is what they would be charged.
We're not able to see the application.
Oh, I thought he had it up on the screen. I'm sorry. Are we not sharing the screen anymore?
There it goes.
Okay. So thank you.
Great. I thought it was already, so we haven't been sharing, you guys haven't been seeing the screen at all?
Correct.
Oh, dang.
We started off at the beginning. At the beginning, we could see it, but after like the second page.
Okay. So these bullets, you see where it's like dots, we're just checking them off or initially, like we just go over each individual section, but it's not a lot of information. Just the normal stuff that you would, because this is a non-medical medical environment, right? So the services you're providing is going to be built to their health insurance plan. So when they do their day treatment groups, when we do any CPST services, which is a community psychiatric supportive treatment, or if we do TBS, which is therapeutic behavioral services, those are considered medical services, but they're not medical. Does that make any sense?
Yeah. So on
Okay.
the consent to treat a minor, it says the above consent is given on behalf of,
And then you put the actual client's name there.
okay,
And then you, because they're a minor, you don't have to explain why, but if they're incompetent, you would say due to not being able to be incompetent or whatever. Then you have to put whoever is filling this form out needs to put their name, date, and time.
if we're filling it out for, filling out things that we can for the caseworker,
I would let the caseworker put name, date, time.
yes. Not the case manager, which is us, but the caseworker.
Yep. And sometimes the caseworker will be like, you got you have consent to do this paperwork
Treat-
for.
Oh, to do the paperwork, okay,
Mhm.
okay. We already
And this
talked
is
about,
what I was talking about, the cost sharing. It just kind of breaks down whose financial responsibility, but the clients that we're working with, they're not financially responsible and they don't have self-pay. So what we would do in an event that they didn't have coverage, we would try to get them some coverage, but also if in the time that they're not able to pay, we would deem it charity.
and it's, okay,
And then this is the confidentiality statement, just letting them know that we follow HIPAA guidelines um in accordance with the state and that their information is private. We won't be sharing it. If they don't have a release of information on file, we will not be sharing their information with anybody. So just giving them that information so they will sign and date here, but not the patient wouldn't, actually the whoever is filling out the paperwork.
or would that be the caseworker or the case manager?
The case
Guardian.
the casework if the caseworker's filling it out, it would be them.
So this, guys, for Patty and Catherine, this part will be, even though we're filling it out, most of it out, this part will be for the caseworker.
Yep.
Because this is the confidentiality statement. Okay. All right.
And this is authorization for us to transport them. We have to have something on file saying that we're allowed to take them from place to place. And then this is for if it's in case of a medical emergency, that we're allowed to get them emergency medical care. Does not apply to y'all because they're not doing SUD. We don't have to do any of that.
Okay, this is all SUD. Gotcha. Like
Yep.
10 minutes.
Hold on, go back up. I think then we can give them a copy of the patient rights because they do go back to where it says patient rights. Here we go. So we will make sure that they have this, and it's just basically letting them know their rights, and then also letting them know if anything were to happen, who they will report to. So it goes over a whole list of stuff, but we don't really. It's their responsibility to read this. Now, compliance, grievances, all of that is summarized in here. So they know who to talk to. Everybody's listed. Clients can file grievances with all of any of them agencies and who they would talk to. Everybody's listed. Sherry Daughtry for our organization is who will be the reporting person at Here's My Turning Point, but they also can file grievances with the Disability Rights Act, OMAS. So what appeals look like if they don't agree with our decision making, any assistance, all of that. So we have to put this stuff in there because we need to make sure we're giving them all the information regarding that's related to our program. And then just overview, these are our normal hours of operation. Because they're doing youth programming, these are office hours. Their programming more than likely will be outside of these hours. And then just going over client orientation, just kind of telling them how they have to enter treatment, explaining what they're responsible for doing, basically just their participation, making sure we have accurate and valid insurance information anytime something changes, making sure that we get the updated information. Just kind of, I would summarize that because they are going to adhere to the program guidelines. Just kind of talks about the treatment plan. That's not something you guys do. It has to be done within 30 days and really 7 days of treatment. So say if we already had started treatment, it was crisis, they have 7 days to do that face to face. So they can do it over the phone now because we have telehealth, but it used to be face to face. And we just put the OAC codes and stuff in here so they know what we're doing. So if they wanted to look it up, they can make sure fact check the information we're giving them. Mental health day treatment services, they put an overview so people can know what's going to be happening. So she put all the stuff in here that we literally went over in training. But I'm gonna be honest, they kind of don't really need to know that. But this helps us. All of this stuff, counseling and therapy groups and all of this stuff, it more so is related to us and not the actual client. But for them to have an understanding of the services they're being provided. Some people don't even give them all this information. We just don't want people to feel like we leave anything out. Anything that we can do to avoid litigation, that's what we do. So with and this helps the actual provider. So this is the stuff that we were going over in the training. Anybody who was in training, do y'all recognize that community psychiatric supportive treatment services? These
Yes.
are all the things that we were going over in that training. And let's see, let's scroll down. So you can give them a copy of that stuff, but really that don't apply to them. You can go down, keep going. Then here, go back. Then it's just basically them signing and dating that they got information about the services. And this is ours. Y'all don't have to worry about that. This is our intra-office thing.
So we don't need to fill,
And
the client doesn't need to.
it's basically that first page all over again. Y'all don't
Okay.
have to worry about that. That's for us.
Okay.
And I'm gonna be honest, if we go back through, hold on, I'm trying. I'm gonna have to pull up another screen so I can. Only forms that are gonna be really looked at is the intake checklist, that intake referral screening form, page 3. We want to make sure that we have page 4 present too. Because when we send it over to the LSW, the patient consent for treatment, which is page 5. We want to keep page 6, but they're not because we need to keep it in their file. So if later on they want to refuse treatment, they can come, we'll have that available for them. Informed consent form, page 7. Then page 10, we need that. Page 11.
Page 10 starts at, page 10 is,
Page 10 is the end of going over like records,
oh,
compensation.
right. Gotcha. Okay. Yep.
They don't even really need to do the cost sharing stuff. They're not gonna be doing self-pay, but we want to sign page 13. We need to just put their name, legal guardian name and stuff, letting them know that that's those are the customary rates for programming. Page 14 will be filled out. 15, that's important because it's authorization for transportation, and then medical emergency form. And we don't do nothing with 16 or 17. Why are these pages blank? Do you got oh, because I was scrolling too fast, my bad. So, yeah, nothing with 16, 17, because that's more for SUD clients. You don't do no with 18. Page 19, 20, 21, 22, 23. All of this stuff is just overview. This is stuff that you're giving the client. That's for them to have about the services. All the way till page 30.
So 19 through 30, they can keep that information from 19.
Yeah, they 19 to 29.
19 to 29. Okay.
Yep. So that's basically they packet. And then you would have them sign page 30. And that's it.
All right.
And then the last two is just really for us. It's our inner office form. So y'all don't gotta fill that out at all. 31 and 32. Then so we would send this over to y'all because the case manager is gonna be the QMHS. So we will have them sign and date here after assessment is done. The actual therapist will be the LSW. They'll sign and date here. And then the clinical director will sign and date this as well. So y'all will have a copy of it, but we'll have it too. And y'all will basically know what their treatment plan is based off of this form.